18,038 people in hospital with coronavirus in the UK. We must keep suppressing this virus. And this isn't just a matter for government or for this House, it's a matter for every single person. And these are always the most difficult months for people's health and for the NHS. And especially with the vaccine already here, we must be cautious as we accelerate the vaccine deployment, as per the winter plan. We've come so far, we mustn't blow it now. Mr. Speaker, when we reintroduced the tiered system, we resolved to review the data every 2 weeks in each area. The sophisticated COVID surveillance system we now have in place means that we can act swiftly and decisively when needed. At the weekend, we held an emergency review for London, Essex and parts of Hertfordshire, where cases are accelerating fast. Yesterday, we held the first formal review, and I must report to the House that across the world, cases are rising once more. In Europe, restrictions are being reintroduced. In America, case rates have accelerated. In Japan, cases are rising once again. Yesterday, the Welsh Government made the decision to tighten restrictions across the whole of Wales. No one wants tougher restrictions any longer than necessary. But where they are necessary, we must put them in place to prevent the NHS from being overwhelmed and protect life. Mr. Speaker, even in a normal year, this is the busiest time for the NHS. As Chris Hopson, the Chief Executive of NHS Providers, reminded us this morning, controlling infection rates is about limiting patient harm. And this is a moment when we act with caution. In the southeast of England, cases are up 46% in the last week. Hospital admissions are up by more than a third. In the east of England, cases are up 2/3 in the last week, and hospital admissions are up by nearly half. It is therefore necessary to apply Tier 3 measures across a much wider area of the east and southeast of England, including Bedfordshire, Buckinghamshire, Berkshire, Peterborough, the whole of Hertfordshire, Surrey with the exception of Waverley, Hastings and Rother on the Kent border of East Sussex, and Portsmouth, Gosport and Havant in Hampshire. These changes will take effect from 1 minute past midnight on Saturday morning. And I know that Tier 3 measures are tough, but the best way for everyone to get out of them is to pull together, not just to follow the rules, but do everything they possibly can to stop the spread of the virus. Where we've seen places get the virus under control and come out of Tier 3, it's where everyone has taken responsibility on themselves to make that happen. We've seen case rates fall across large parts of England, and I know that many places in Tier 3 have seen their rates reduce. In most places, I have to tell you, Mr. Speaker, we are not quite there yet, and the pressures on the NHS remain. But we are able to move some places down a tier. We assess these decisions according to the 5 published indicators: case rates amongst the over 60s, test positivity, rates of change, and hospital pressure, and today I'm placing in the Library of the House an assessment of each area and publishing the data on which we make these decisions. For the vast majority of places currently in Tier 3, we're not making a change today. However, Mr. Speaker, I am pleased to say that some places can go down a tier. In Bristol and North Somerset, rates have come down from 432 per 100,000 to 121 and falling. And I can therefore announce that Bristol and North Somerset will come out of Tier 3 into Tier 2 on Saturday. Rates in Herefordshire have also come down to 45 in 100,000 and are falling, and we can therefore bring Herefordshire out of Tier 2 and into Tier 1. I want to pay tribute to everyone who's been doing the right thing and getting rates down, whether or not your area has come down a tier today. It's so vital that everyone sticks at it and does the right thing, especially over this Christmas period. And it's important to remember that this can be a silent disease. 1 in 3 people who has the disease has no symptoms but can still pass it on. Everyone, therefore, has a personal responsibility to play their part in keeping this pandemic under control. I know that other areas are so eager to move down tiers, and the best thing we can all do is act with responsibility to get the virus under control. Mr. Speaker, these restrictions are thankfully not the only tool we have now to fight the disease. We're further expanding our testing programme, and later today the Education Secretary will set out further action on school testing in the new year. And of course, the vaccine rollout is accelerating. I can update the House that over 200 vaccination sites are now open in all parts of the UK, with more opening their doors and bringing hope to communities over the coming days. And I know that everyone will be as thrilled as I am every time they're contacted by a friend or a loved one getting the jab. It was a wonderful sight to see the global map of vaccine deployment, with the UK proudly standing out as the site of the first vaccinations. It's a huge logistical challenge, but the vaccine offers us promise of a better year ahead. And until the great endeavour of vaccine deployment reaches enough people to make this country safe, we must keep doing what it takes to protect our NHS and protect those we love. That means all of us doing our bit, following the rules and taking personal responsibility to help contain the spread of the virus, so we can get through this safely together. And I commend this statement to the House.
I now call the Shadow Secretary of State, Jonathan Ashworth.
Well, Mr Speaker, and I thank the Secretary of State for advance sight of his statement. These past 12 months have seen COVID spread with speed and severity. Over 65,000 have died in the United Kingdom, at least 620 of them health and care workers, making the ultimate sacrifice in the line of duty. Over 240,000 have been treated in hospitals with the disease. And as the Secretary of State reminded us, what gives this virus such lethal advantage is that people who appear healthy can go about their lives unaware they are transmitting the virus to others. So of course we accept and understand why he's had to move areas into higher tiers today, even though this means tens of millions of people across England are now living under the toughest restrictions. And we're grateful that he's placing in the library details on each of our local authority areas. But 2 weeks ago, he did say that we have the virus under control. And he also said we can't risk letting cases rise again, especially into Christmas. But I'm afraid that is exactly what is now happening, isn't it? Yesterday, England reported over 23,000 cases, the highest numbers in a month. Hospital admissions on 14th of December were the highest since 16th of April. The number of people in hospital with COVID is now the highest since the 22nd of April. The number has risen 20% since the end of lockdown. If it goes up by another 20%, we are back at the same peak we saw in April. These numbers should be sounding all the alarm bells there are, and it's why clinicians are pleading with him to put robust arrangements in place to keep people safe through Christmas. We saw in Canada and in the US huge spikes in infections following the Thanksgiving. We will see a spike here. This isn't about cancelling Christmas. Santa will still deliver his presents, but is he really telling us that allowing indoor mixing of 3 households across regions and generations for 5 days is sensible, given the virus is raging with such ferocity at the moment? And the devastating tragedy is that those who will be most impacted by this virus spreading through the easing are those who will be at the front of the queue for the vaccine in the next month or two. So will he look again at the Christmas arrangements? On vaccination, with more than 130,000 vaccinated in the first week, that is a good thing, and we celebrate and we congratulate all involved. But to vaccinate every older person, vulnerable person and key worker by Easter, we'll need to do something like double that every day. The National Audit Office this week said 11.7 billion for the programme will be needed, alongside 46,000 extra staff. So how much is actually allocated to the vaccine programme at the moment? And how many staff have been taken on and trained to support the vaccination programme? And when will we see the mass vaccination centres opened in our constituencies? There have also been warnings today about vaccine rollout in primary care taking longer than planned because existing software systems keep crashing. The system doesn't alert GPs if a patient on their lists has already had it in the hospital, and GPs are forced to turn to pen and paper for data capture. So when will there be a national call and recall system for GPs, and why wasn't it ready for the rollout this week? He mentioned the Secretary of State for Education is to make a statement on schools. I don't know if that means he's coming to the House or not, but with schools going back in January, can he provide some clarity around testing in schools, because there is some speculation that the opening of schools will be delayed by a week in January. Could he give us an update on what is happening on that front? Finally, Mr. Speaker, Madam Deputy Speaker, this has been a dismal year for our National Health, for all of us, but our National Health Service workers and our care workers have, as always, done us proud. So can I put on record my thanks to all of them, many of whom will be working through the Christmas and New Year period. And can I also thank all those working on the response to COVID, his departmental officials, our medical science community, our public health teams as well. And with that, can I wish you, Madam Deputy Speaker, and all working in the House, and indeed the Secretary of State, a safe Christmas and a Happy New Year.
Secretary of State.
Thank you very much, Madam Deputy Speaker. Well, the honourable gentleman rightly asks about the arrangements in place for Christmas, which the Prime Minister set out yesterday very clearly. Christmas is a very special time of year, and that's why we've put in these arrangements that we have. And it is a matter of people's personal responsibility to ensure that they act and they see their loved ones in a way that is safe and careful. And I think people understand that. And what's more, I think people will abide by it. We know that it is safer to see older people, especially if they're over 70 or clinically extremely vulnerable, if you've taken the care to reduce social contact beforehand. And we also know that after Christmas, being able to reduce social contact will be important for keeping this under control. And I think that aspect of personal responsibility is important. Sometimes in this House, it feels to me like the debate is as if we don't in government put in place concrete rules, then nobody will take any action. Actually, it's down to individuals, each and every one of us, to take responsibility for our actions within the rules, of course, but also being cautious. This is a massive team effort, and it is my experience of the last few months, is that when a community has come together to get case rates down, that is when it has happened and when it has worked. And even with the rules in place, it is only when the community essentially comes together to get this under control that you get the cases coming down and the pressure on the NHS. I regret having to take the action that we have to take. I deem it necessary, and there's a strong view right across government that these actions are necessary. But I also plead that personal responsibility is absolutely central to how we as a society should respond to this pandemic. He asked about the mass vaccination rollout. The mass vaccination sites are appropriate for the Oxford AstraZeneca vaccine, should that come through and be approved by the regulator. And so it is some weeks until we'll see those rolled out. However, we are every day having more and more primary care sites coming on board with the rollout of the Pfizer vaccine. And it's very good to see that happening, and I expect the numbers that are vaccinated to accelerate. The team have made a very, very good start, and there's a long way further to go. He asked about the data systems. The data systems have very largely been working very effectively. Of course, any very large logistical rollout like this has niggles, but they are small and been brilliantly dealt with locally on the ground. He asked about the rollout of testing in schools. As I say, the Education Secretary will set out more details about offering all secondary schools, colleges, special schools and alternative provision settings the help, support and facilities to test as many secondary age and FE students as possible as they resume their education in January. And I thank in advance all of the work of teachers and support staff in schools who will no doubt lean in and support this task to make sure that school return can be done as safely as possible. And finally, may I echo the words of the Honourable Member and wish him a happy Christmas and a safe Christmas, and I look forward very much to seeing him again in January.
And now we go to the Chairman of the Select Committee, Jeremy Hunt.
Thank you, Madam Deputy Speaker. In the last week, I've received unexpectedly joyful emails from residents of South West Surrey who have been amongst the first in the world to receive a clinically approved vaccine for coronavirus. So can I thank him for that early Christmas present, and also thank him for the energy, the endless media rounds, and the dedication that he has shown in the last year, which must be one of the toughest imaginable for a health secretary. And I'm also grateful that Waverley has been excluded from the Surrey-wide move to Tier 3 in recognition of our lower infection rates, although we will remain vigilant. I want to ask him about Christmas just a week away. Of course, personal responsibility matters, but in a pandemic, so does clarity. So irrespective of the law or the regulations, should we or should we not have indoor social gatherings with elderly and vulnerable family members?
Madam Deputy Speaker, people should act with great caution. People should act with great caution in this pandemic because it protects them, it protects their families, it protects their loved ones. We've set out what the rules are, but they are not a limit up to which we should all push. We can all act within those rules to limit the spread. And by reducing social contact in the days up to meeting a family member who may be, for instance, over 70 or any other family member, it is reasonable and responsible to take that sort of action. I'm very grateful for what he said about the vaccine rollout. That it is. I've been cheered by messages I get from constituents and others now that they're receiving the vaccine, and we've just got to make sure we get this deployment out as fast as the vaccine can reasonably be produced, and as fast as the NHS can deploy it, so that we get people the safety of that vaccine, and so we can get through this and out of this as soon as possible.
Now we go to Scotland, to the SNP spokesman, Martin Day.
Thank you, Madam Deputy Speaker. It is important that the festive days ahead do not become a 5-day mass get-together. Therefore, we should use as little of the flexibility as possible, spread over several days, while ensuring that no one is facing Christmas alone. The concerns from medical professionals that the Christmas COVID restriction relaxation will cost lives are not to be dismissed lightly. And would the Minister agree with me that if people are to form a bubble, that it should be kept as small as possible? And if so, would it not be better to follow the Scottish approach, which sets a strict maximum limit on the numbers of up to 8 people from 3 households, rather than the potentially unlimited numbers permitted currently in the English bubbles?
Well, this has been an incredibly difficult year for so many people and for so many families. And the fixed numerical limits have a particular burden on very large families. And so we have taken, I think, a balance and the right approach. But, Madam Deputy Speaker, I understand the urge for caution. Of course, I understand that from my NHS colleagues and others. But, Madam Deputy Speaker, I also understand that people want to see their children, people want to see their loved ones. And Christmas is an important time of year, and we've got to find a balance.
Sir Bernard Jenkin.
Thank you, Madam Deputy Speaker. And may I join with my right honourable friend in wishing our NHS staff and everyone in this crisis a happy Christmas. But would you also join with me in wishing the Essex County Council and local authorities in Essex a happy Christmas, because what they're now contributing to the test, track and trace operation since the NHS Test and Trace started to share data much more quickly with local authorities. Can I report to him that most districts have now started door knocking to follow up contacts and cases, and the complete case and contact rates are now around 87% and 90% respectively. Would you join with me in congratulating local authorities in Essex on this tremendous effort?
My right honourable friend is absolutely right, and I'm grinning because I think this is the first time of the dozens and dozens of statements I've done this year when the honourable member opposite hasn't mentioned track and trace. And I'll tell you why, Madam Deputy Speaker. It's because the latest statistics show that where communications were available, 96.6% of people were reached and told to self-isolate. And that's because of the huge improvements in contact tracing and in testing that have been delivered this year, including, of course, with local authority partners, but also with the brilliant national NHS test and trace system, which we should all congratulate. I think that getting those contact rates.
Order. This is not a moment for shouting. Listen to the Secretary of State. Secretary of State.
I think the moment when we see contact rates over 90% should be a moment when everybody should come together and say thank you and well done to everybody at NHS Test and Trace and all of their partners, whether they're in the public sector or the brilliant private sector partners who we all support.
Now we're going to Bradford, to Judith Cummins.
Thank you, Madam Deputy Speaker, and happy Christmas to you and yours. The Secretary of State will know the significant effect the pandemic has had on NHS dentistry. There is a backlog of more than 19 million appointments. It is therefore shocking and unacceptable that NHS England has just decided to impose a new activity target on dentists in England, which many will simply not be able to meet under new COVID restrictions. NHS England's own data shows that nearly 60% of dental practices will be hit with severe financial penalties. Dentists will now need to prioritise checkups rather than dealing with a backlog of patients needing treatment. Others may be forced to close entirely. A straight choice between staying financially viable or treating those in pain with more complex problems. Will the Secretary of State reverse this decision, which threatens patient safety and access and could lead to the demise of NHS dentistry as we know it?
Madam Deputy Speaker, I'm very glad to be able to reassure the Honourable Lady that this agreement that has been reached with the dentists is all about making sure that whilst we support our NHS dentists, we also, of course, want to see them doing as much as they can to look after people and to get the treatments that they need. So this is a good balanced programme and I'm sure it will be implemented well by the dentists.
Dr. Liam Fox.
Thank you, Madam Deputy Speaker. May I say how delighted I am that North Somerset is moving down into Tier 2, which is just reward for the efforts of my constituents and the whole community in the measures they've taken, and also offers great potential help for our hospitality industry as we go into the Christmas period. And on the question of balance, can I completely agree with my right honourable friend? It's not just about the number of people and the number of households, it's also about the age and vulnerability of those who are meeting that we have to consider. And can I just say, in echoing words of one of my colleagues, a very happy Christmas to my right honourable friend and his team of ministers who have done the most difficult job imaginable in a rather exceptional way. And we hope that, but not in much expectation, that they get some break over the Christmas period.
Thank you very much, Madam Deputy Speaker. Well, the people of North Somerset, who he represents, and also of nearby Weston-super-Mare, have done a remarkable job in bringing the case rates down to, as I say, to 120 for every 100,000. I'm very pleased that we're able to take North Somerset out of Tier 3 into Tier 2. But I would also say to everybody that the point about personal responsibility, which he stressed and I strongly agree with, it still applies. Because coming out of a tier does, of course, make life easier, and we don't want these tiers in place longer than absolutely necessary. But it is still all on everyone in North Somerset to do their bit, and in Bristol and Herefordshire, which have also come down, to do their bit and to keep those case rates down.
And now we go to Hull, to Carl Turner.
Thank you, Madam Deputy Speaker. The lead up to Christmas is the busiest period for hospitality businesses, with some pubs in my constituency making up to a quarter of their annual profits, which are now lost. If measures to control the virus are to be effective, they must go hand in hand with proper business support. To protect lives and livelihoods, what's he going to do to make sure businesses forming the backbone of my communities in Hull get the financial support they desperately need?
Well, I think that everyone in Hull should feel. I feel gratitude to them for the work that they've done to get case rates down as far as they have. Hull has done well, along with the rest of the Humber area, but we're not quite there yet. And so we are putting the support in that comes with being a part of Tier 3. We've put record sums in to support hospitality, but I appreciate this is tough, especially in the run-up to Christmas. So I can commit to keep working with the Honourable Gentleman and with other colleagues across Hull, Humber, the other areas that are in Tier 3 to do everything we can to get the hospitality open again.
Kate Griffiths.
Thank you, Madam Deputy Speaker. I want to pay tribute to the work of Staffordshire County Council in rolling out rapid and large-scale asymptomatic community testing in my constituency of Burton and Uttoxeter. The Director of Health has raised a number of concerns with the department about the lack of clarity over funding for these tests. Will my right honourable friend review the 3 letters that have been sent to his department on this issue in order to provide the clarity which is urgently needed to allow this testing to continue?
Yes, I'll get onto it right away. I'm really glad that Staffordshire have done they've really worked hard on getting this community testing going. Stoke-on-Trent was one of the first places in the country to get going on it, and now we've spread it out to wider in staffs. I'll absolutely pick up the point that she raises, and I'll get back to her straight away.
Stella Creasy.
Thank you, Madam Deputy Speaker. The Secretary of State tells us about personal responsibility. Does he recognise that he has a responsibility to be honest with the public about what is happening as well? This week, Whipps Cross Hospital had to turn away ambulances because the ICU was full as a direct result of the rising COVID infections in our local community, and the hospital had to move to early discharge of patients. The Secretary of State says he's publishing data. Will he commit to publishing real-time data about A&E fire breaks, ICU capacity, and what elective surgeries planned surgeries have been cancelled by hospital, so the public can see the truth about why and how we need to protect the NHS and what impact it has on their health outcomes?
Well, Madam Deputy Speaker, the Honourable Lady is absolutely right about the impact of the virus on the NHS in her part of the world. In North East London, Whipps Cross Hospital is under significant pressure. The case rate in her Waltham Forest local authority is 431 per 100,000. We've got to work together to get the cases down, especially in East London, where it's very, very significant. And we publish a huge amount of data on the hospital admissions and the impact on the NHS. And I'm publishing further data on this today and putting it in the Library of the House.
Felicity Buchan.
Thank you, Madam Deputy Speaker. I'm glad to see that 3 areas are coming down a tier, and I think that is vitally important for compliance going forward, because the general public needs to see that if they do follow the rules, get their cases under control, then there will be payoff. Does my right honourable friend agree with me that what is important is complying with existing restrictions rather than ever more severe restrictions, and it is critical that we take the public, including the young, with us?
I agree with every word that my honourable friend has just said. I strongly agree that the best way to get out of Tier 3 is by everybody coming together to comply with restrictions, but not just to comply with them because they're the law, but to take that responsibility to ensure that we don't spread the virus, which each one of us unwittingly can do because of its asymptomatic nature. So I thank my honourable friend for her question and also for the message that it sends, that we can get areas out of Tier 3, we can get areas out of Tier 2 into Tier 1. We've got to all work at it.
Munira Wilson.
Madam Deputy Speaker, I asked the Secretary of State via a written question the estimate his department had made of the proportion of the population not registered with a GP, to which the answer was no such estimate has been made. I found this concerning, given how important GPs are to the rollout of the COVID-19 vaccine, not least for vulnerable populations such as the homeless and those who move around a lot. So could the Secretary of State please explain what plans and provisions are being made to ensure the vaccine is available to those who aren't registered with GPs?
The Honourable Lady raised an incredibly important point, because it doesn't matter whether you're registered with anybody or not. You can still spread the disease. And so the reason for the answer that she states is that we have to try to get the vaccination program out to everybody, no matter their status. And there are people who don't have any status in paperwork at all, and we need to make sure that we support the rollout to them as well. And we're working with the Communities Department, who are best placed, along with local authorities, to do this, and to make sure that the vaccination program reaches anybody who fulfills the criteria set out by the Joint Committee on Vaccinations and Immunisation.
Mark Harper.
Thank you very much, Madam Deputy Speaker. Can I welcome the fact that Gloucestershire is remaining in Tier 2? Can I thank the Secretary of State for the engagement he had with me and my Gloucestershire colleagues this week. Very much appreciated, and it was very much a team effort to get to where we are. Can I press him a little on what he said about vaccines? In the data that's going to be published from next week, can he confirm that it will have enough detail in it so that we can see clearly the vaccination rollout by age and by area? And can he set out early, when we return in January, the government's thinking about how far the vaccination programme needs to have gone, the level of risk we will have reduced the country by, so that we can start releasing the restrictions that are so burdensome on our population?
Yes, we're committed to setting out weekly updates on the vaccination programme. The first data we released obviously was yesterday, the 137,000, and also increasingly in the sorts of breakdowns that he asked for, as more and more groups are reached, and the calculus that he asked for in terms of the proportion of the population who need to be protected in order to be able to bring down restrictions is exactly how we are thinking about the next phase. We don't yet know the impact because of the vaccine on transmission, and therefore we can't have yet a concrete answer to his question, but it's precisely the question that we're asking, and within the next few weeks we should know much more.
Chris Stevens.
Thank you, Madam Deputy Speaker. Recent studies have shown that vaccine hesitancy is highest among the BAME community and low-income groups, with the real fear that these groups are being deliberately targeted with misinformation. So can the Secretary of State tell us how his department is going to counter this so that people can make informed choices and to avoid COVID health disparities going forward?
Yes, he's quite right to raise this, and in fact, I was talking about the vaccination programme to the SNP Health Cabinet Secretary only this morning, because making sure that we reach all who need vaccinations according to clinical need is absolutely critical, but also then persuade them to take the vaccine. So there's a huge amount of work on tackling misinformation. The most important thing is to have the positive information out there, and I want to thank all those who've gone public with their vaccines so far. We all saw Zoe McKellen. I thought a wonderful photograph. I want to thank Prue Leith, who went public with her vaccination. It's absolutely terrific seeing people celebrating the fact they're getting vaccinated, and therefore encouraging other people to do the same.
Sir Graham Brady.
Thank you, Madam Deputy Speaker. I tell my right honourable friend the statement will be greeted with dismay in Greater Manchester, where we have had severe restrictions for 9 months, where in 9 of the 10 boroughs rates are below the national average. Can I tell him as well that my constituents have behaved responsibly and that our rates are lower than they are in neighbouring Warrington or in neighbouring Cheshire, which have been put into Tier 2, and are also lower than they are in Bristol, which has been moved from Tier 3 to Tier 2 today. What exactly do we have to do to be moved out of Tier 3?
Madam Deputy Speaker, I understand my right honourable friend's disappointment at this decision. We look very closely at Trafford, at Stockport, at Tameside, at nearby High Peak, and at the proposal to take a different decision for them with respect to their near neighbours. The challenge is that each time that we've done that in the past, we've then seen cases rebound, and there continues to be significant pressure on the NHS in the northwest, including in Manchester. So I know that my right honourable friend and I have proposed different approaches on this one, and I look forward to working with him and people right across Manchester to get this sorted.
Rachel Hopkins.
Thank you, Madam Deputy Speaker. We need to make sure that schools continue to be a safe environment for students and staff, and I'd like to take the opportunity to thank all school staff and head teachers across Luton who've done so much to make their schools as COVID secure as possible. I note the point made by the Secretary of State around the announcement later around testing in schools, but will the government be publishing the evidence to support the use of lateral flow tests for serial testing of students, as this is outside of the licensed use and requires a change to the legal duty to isolate?
We are working on exactly that proposal because the need to use testing and use the easily available and rapid return lateral flow devices is incredibly important. They have an important role to play being used in the right settings, in the same way that the PCR tests have an important role to play, but it takes longer to get the result back. So I look forward to working with her, with Luton Council and all those across Bedfordshire to try to get this sorted. Clearly, case rates in Bedfordshire are shooting up in a very worrying way, and I thank her for her efforts and for her public health messaging to say to everybody right across Bedfordshire, including in Luton, let's work together to get this sorted.
Greg Clark.
Thank you, Madam Deputy Speaker. I asked my right honourable friend to consider restrictions on a more local level than county-wide, and I'm grateful that he's done that across the country today. Infections in Tunbridge Wells, whilst much lower than the average for the County of Kent as a whole, are nevertheless rising, and there is pressure on the local NHS, so I understand why there is no change from Tier 3 today. But will the Secretary of State commit to apply the 5 tests fortnightly and to reduce our level of restrictions as soon as they're met? And will he have a word with the Chancellor to see what extra support can be given to businesses in the hospitality sector who have just lost what is the most important part of the trading year in what has been a miserable year for them?
Yes, of course I will, and I'll talk to the Chancellor about the point that he raises. Of course, we do already have a significant amount of support for hospitality businesses, but I understand how difficult this is. On the point about looking at local areas, absolutely we will look at local areas, and we've demonstrated that in the decisions taken today. For instance, just over the border in East Sussex, we've unfortunately had to put Hastings and Rother into Tier 3. Tunbridge Wells today has a case rate of 288 per 100,000. And I would say to everybody right across Kent that we really need to act with serious responsibility right across Kent. No matter which part of Kent you're in, we have a very serious problem in Kent. And the only way that we can get it under control is for people in Kent to essentially behave as if they have the virus and are trying not to pass it on to somebody else. Be really cautious in Kent. It is the area of the country which has the biggest problem, both in terms of case rates and in terms of, therefore, the huge pressures on the NHS in Kent. I want to thank everyone working in the NHS in Kent for what they're doing, and we're putting in as much support as we can, and I look forward to working with my right honourable friend and all colleagues from across Kent, and of course the County Council, the District Councils, to try to get this under control. Other parts of the country have done it and brought the case rate down, and some so far that we've been able to take them into Tier 2. I'm sure we can get there in Kent, but we've really got to work hard to make that happen.
Kevin Jones.
Thank you, Madam Speaker. On Monday, I asked the Secretary of State when care home residents in County Durham would get the vaccine, and he didn't answer the question. I've now been contacted by GPs in Chester Street in my constituency who were first promised the vaccine on the 16th of December. This was then put back to the 21st of December. Having done all the work to set the hub up, they've now been told the vaccine will not be available till the new year. So can the Secretary of State tell me when residents in Chester Street in my constituency will get the vaccine? And can I just say to the Secretary of State, I don't want hype, I don't want generalisations, I just want a straightforward answer for those constituents.
We are opening more and more GP vaccination hubs each day, and so the answer specifically on Chester Street is as soon as we practically can, but it has to be done in a safe way, and that is out of my hands, out of his hands, and it is an important operational set of procedures that need to be gone through to open these hubs. It is complicated. I will look into his specific example. I'll write to him with details, but he will understand, as will, I'm sure, the people of Chester Street, that we're trying to get this vaccine rolled out as quickly as safely possible, but safely is an important part of that.
Neil O'Brien.
Thank you, Madam Deputy Speaker. Can my honourable friend confirm that if people in Harborough and Erdby and Wigston continue to drive down rates of infections locally, the different districts and boroughs in Leicestershire can be put in different tiers if the data supports that? And will you join me in congratulating our local NHS here in Leicestershire for the efficient way that they are rolling out the vaccine across the county?
Yes, on both counts, Madam Deputy Speaker. We looked at Leicestershire in great detail, and I wish that we could have taken some parts of the county out. I would have wished that we could have taken the county and the city out of Tier 3. Unfortunately, the data didn't support that conclusion, and I'm grateful to everybody across Leicestershire, because I know this has been a long, hard slog in Leicestershire with measures that have been in place for a long time.
Liz Twist.
Thank you, Madam Deputy Speaker. And can I start by thanking the people of my constituency and across Gateshead who have worked really hard to get the figure down. Professor Michael Marmot's COVID-19 review published this week shows that this pandemic has only exposed long-standing health inequalities, particularly in the north. Public health teams play a vital part in this pandemic and are core to addressing those longer-term health inequalities. What has the Secretary of State done to make sure that public health teams are properly funded to address those inequities and can, as Professor Marmot says, build back fairer?
Well, we are absolutely determined to build back better, and that will absolutely need to involve tackling long-term underlying health inequalities. There's a huge programme of work that's going to be needed to do that after these inequalities have been demonstrated by this pandemic. People in Gateshead have done a great job of getting the case rate down. As with other areas, still in Tier 3, we're not quite there yet, and I know that my team and her local Director of Public Health have been talking about getting Gateshead and the rest of the North East into Tier 2 when we can, I hope that we can do that. But for now, let's be cautious and let's keep this under control.
Julian Sturdy.
Thank you, Madam Deputy Speaker. There will be naturally disappointment across Yorkshire as many areas stay in Tier 3. And I appreciate that York's tier position will obviously be affected by the current virus picture. But can I ask the Secretary of State which of the 5 criteria the City of York will have to improve on to stand a good chance of moving down a tier at future reviews? And will this depend to a significant extent on how our neighbouring local authorities perform against these 5 criteria?
Well, we do look at those human geographies because many people commute from North Yorkshire into York, but York and, in fact, many of the local authorities around it have done an absolutely fantastic job of bringing the virus under control. In York, the case rate is 65 per 100,000, a little bit higher than we typically take places into Tier 1. For instance, Herefordshire is 45, which is the same level Cornwall was when it was put into Tier 1. But it's moving in the right direction. The over 60s case rate is also low, and there has been some pressure, as he knows, on the hospital, but that is abating. So York and large swathes of North Yorkshire are moving in the right direction, and I would urge everybody right across North Yorkshire to stick at it.
Barbara Keeley.
Thank you, Madam Deputy Speaker. The Secretary of State will remember that he has agreed to meet me and my constituent Kelly Shears in order to discuss the issues that she has had accessing cancer services during the pandemic. During the pandemic, Kelly worked on the front line with our ambulance service in Greater Manchester, despite her history of breast cancer. But she couldn't have her checkup and mammogram when it was due. When she did have it, the cancer had returned and spread to her bones. She is now having chemotherapy and may need surgery. I understand the Secretary of State has many demands on his time, but can he ensure that this meeting is able to go ahead in early January, as these matters are time sensitive?
Yes, I can. I'm very sorry that meeting hasn't happened yet, and we'll get right onto it for early January.
Richard Fuller.
Speaker, the changes announced by my honourable friend for Bedfordshire will be disappointing to residents and businesses, but I think it will be helpful for them to understand that my right honourable friend is setting up the tier system, established clear criteria and is publishing the data, and has said that he will be open to regular reviews. But on those criteria, Madam Deputy Speaker, when it comes to the issue of hospital pressure on the NHS, that is not a data-driven criteria. It comes with statements that the NHS is under considerable pressure, which is very difficult for people to understand because we always hear, pre-COVID times and times now, that the hospitals are under pressure. So will my right honourable friend commit to producing projections of occupancy rates and acute bed occupancy rates across the NHS, and if possible down on a local hospital system basis?
Yes, we are working exactly on how to demonstrate that in a numerical rather than a narrative form, not least for the reasons that he sets out. Yeah, I'd say to him that across Bedfordshire we've seen this very sharp rise in cases, especially in the more rural areas actually, including northeast Bedfordshire. So it's so important that people across Bedfordshire take that personal responsibility, follow these new Tier 3 rules, and I hope that we can get it to come down as fast as it's gone up.
Toby Perkins.
Thank you, Madam Deputy Speaker. People across Chesterfield will be very disappointed that with all the work they've done and with Chesterfield having lower transmission rates than some of those areas in Tier 2, that they remain in Tier 3. And they'll be particularly disappointed by the Health Secretary's suggestion that those communities who've worked hardest and been most disciplined are the ones that are in Tier 2. We know that isn't the case. But doesn't the Health Secretary realise that if the government could offer a support package that would support our hospitality sector, if the government weren't at the very last minute announcing changes to our schools just 2 days before the schools break up, there would be more credibility to the sense that it's personal responsibility that's the problem here, rather than the ineptitude of this government.
No.
Sir Edward Lee.
On behalf of my right honourable friend for South Holland and the Deepings, can I thank the Secretary of State for meeting us and promising that he will adopt a more granular approach, and we can assure him that we'll work hard in Lincolnshire to try and get our tier down, and those of neighbouring cities. Can I also thank him and the Prime Minister for resisting pressure from the opposition and from Wales and Scotland to change the rules on Christmas? This is entirely a right approach, and thank him for the tone that he's adopted today, that if we're to defeat this, it's a matter of self-responsibility and personal ownership of our health.
Right. Well, that's right, and I think that we did look very closely at the southern end of Lincolnshire, which is a long way from where the rates are incredibly elevated around Lincoln and the coast and West Lindsey. But unfortunately, it wasn't possible to bring any of the lower tier local authority areas in Lincolnshire out of Tier 3, and unfortunately over the border in Peterborough we have seen a very sharp rise. So we're not there yet, but I hope that we can make significant progress, especially if everybody listens to my right honourable friend and takes personal responsibility for their action to try to do everything they can not to pass this disease on.
Jack Dromey.
Madam Deputy Speaker, Jane Roach is a great champion of her community of Castle Vale. Her dad, Vincent, died of COVID. Her sister, Jocelyn, died 5 days later of COVID. They are two of the nearly 10,000 in the West Midlands who have died of COVID. Jane and her family are devastated. They grieve for the loss of their loved ones who will not be with them this Christmas. And she asked the Secretary of State this, why we had the highest number of deaths in Europe. Can we be confident that lessons are being learnt, that the mistakes made will not be repeated? She asks, when will the inquiry into what happened over COVID be established? And crucially, she asked, will the Secretary of State meet with her and other relatives of those who have sadly died from across Birmingham?
Yes, Madam Deputy Speaker, I'm very happy to meet with the honourable gentleman and constituents to hear their stories. Many of us have lost those close to us in this terrible pandemic. We're constantly learning about how to do things better. We're constantly learning more about the disease. For instance, the news earlier this week about a new variant was because of our surveillance system that we have to be able to look out for changes and then to try to understand them. And so there are huge challenges, as he knows, but I try to approach this always with the view of looking at how we can get the country through what is an incredibly difficult and unprecedented time with as few people as possible suffering in the way that his constituent Jane has.
Rob Butler.
Thank you, Madam Deputy Speaker. The news that Buckinghamshire is going into Tier 3 heralds the bleakest of midwinters, especially for local hospitality businesses, and it is imperative they get extra help and that this lasts as short a time as humanly possible. Given that Stoke Mandeville Hospital is currently under intense pressure, with many staff off sick, either with COVID or self-isolating, it is alarming that Buckinghamshire Healthcare Trust currently has been given no date when it will get a supply of vaccines, especially when neighbouring Oxfordshire is in a lower tier and does have them. So will my right honourable friend ensure that residents and healthcare staff can get the vaccine locally in Buckinghamshire before Christmas?
I'll write to him immediately with plans that we have for the rollout of primary care-based vaccination facilities in Aylesbury. I regret having to put Buckinghamshire into these into the Tier 3 measures, but it was unfortunately absolutely necessary on the numbers. Aylesbury Vale, the local authority area, has a case rate of 235 and it's rising really sharply. And my honourable friend set out the challenges at Stoke Mandeville, which is an excellent hospital, but under significant pressure. So I'm glad that he understands why we've had to take this decision. And I hope that across Buckinghamshire we can get these cases down and we can get people vaccinated as soon as possible.
Jeff Smith.
Thank you, Madam Deputy Speaker. The secondary schools in South Manchester are worried about the extra pressure of running a mass testing regime on top of the contact tracing they're doing, on top of the online learning they're enabling, and on top of their normal school everyday responsibilities. We really need to know what support they're going to get to do the testing. So why isn't the Secretary of State for Education coming to the House to set out the plans and answer questions, as the Secretary of State for Health rightly does?
Yeah.
Well, the Secretary of State for Education will, as he said, be setting out these plans. We need to get them out as soon as possible so that people have got the last couple of days of term to work on them, and he'll be doing that. Look, testing in schools is incredibly important. It's going to become more important as we roll it out more broadly. And I'm really glad to hear some of the statements from some of the teaching unions about how enthusiastic they are for testing, especially in secondary schools. And I'm sure that my right honourable friend, the Education Secretary, will want to work with him and others right across the country to roll out this programme as effectively as possible and make sure that we have high-quality testing in schools so that we can keep kids in education as much as possible and get the infection rate down by finding those positive cases and having them isolate.
William Ragg.
Thank you, Madam Speaker. It being Christmas and given the circumstances that we're in, COVID-compliant carol singers in Stockport have been heard to be singing the words of that well-known epidemiologist Mariah Carey, all I want for Christmas is tier 2. But sadly, in treating that outcome hasn't been successful at all. So can my right honourable friend, further to honourable friend the member for Altrincham, explain precisely what more residents in Stockport need to do in order to regain some relative freedom?
Well, yes, we've got to keep getting the case rate down. In Stockport, it's still over 100. There's further to go. And right across Greater Manchester and the surrounding areas, I would urge people to do as they have been doing, because those case rates have come down really quite significantly. And the city, right across Greater Manchester and in Stockport, people have been doing the right thing. But the pressures on the NHS remain, partly from people who are in hospital with COVID from when the rates were really high. So I hope that we can make the move as soon as possible. And in the meantime, I hope that everybody has a happy and safe and careful Christmas in Stockport.
Ellie Reeves.
Thank you, Madam Deputy Speaker. UK and EU pharmaceutical companies have warned that no deal will lead to delays of up to 6 weeks in obtaining vital medicines. Given the Pfizer vaccine is complex to move and distributed from Brussels at -70 degrees, does the Health Secretary agree that no deal would be catastrophic and that everything should be done to get a deal to protect our access to vital medicines?
We've got plans in place to ensure that the vaccine can continue to be distributed, whatever the outcome of the discussions on a future trading arrangement with the EU.
Robert Harford.
Thank you, Madam Deputy Speaker. Early this morning, I visited a vaccination centre in Harlow, which is running like a military operation and has started vaccinating the elderly and those in care homes. Will my right honourable friend thank West Essex CCG, GPs, staff and volunteers who are vaccinating many hundreds of Harlow residents, but will he also set out a route map by which Harlow can return to Tier 2? Could I just ask him, I strongly welcome the testing announced for schools, but can he also confirm that school openings will not be delayed in January?
I'm very grateful to what he said about the vaccination centre in Harlow. It's an uplifting sight visiting a vaccination centre, and rarely have I seen so many smiles on faces in this year, which has been such a difficult year, than when I visited the Milton Keynes vaccination centre last week. And I'm really glad that it's working well in Harlow. I want to add my thanks to his thanks for the GPs, the volunteers, the staff, all those organising the vaccinations. In terms of a route map out of Tier 2, of course, in time the vaccination programme will help, but for now the best thing people can do is to bring the case rate down by doing everything they personally can to not pass on this disease. Unfortunately, the case rate is 302 per 100,000 in Harlow, very, very elevated. And nearby Epping Forest, unfortunately, is over 500. It is a very serious problem. We've all got to pull together to try to sort out this growth of the virus locally, and that is the route to Tier 2.
Can I echo to the Secretary of State what my honourable friend, the member for Harlow, said on behalf of the people of our community? Thank you.
Sarah Owen.
Thank you, Madam Deputy Speaker. Scientific advisors, healthcare workers and doctors have all warned that the Christmas season will result in higher infection rates. The public aren't fools and know that tougher restrictions will likely be needed in the new year. Will the Secretary of State come out with the obvious and admit now that he will need to bring harsher restrictions in January, ending the uncertainty faced by families and businesses, or will he just allow these dangerous mixed messages to continue from government?
Where I agree with the Honourable Lady is that the public aren't fools, and the public know that it is their responsibility, as well as the government's, to get this under control. And that is where the emphasis on people taking personal responsibility to ensure that they don't pass on the virus this Christmas, that's where the emphasis comes from. I think if you look at how the public as a whole, across Luton and across the whole country, has behaved during this pandemic, where we have these restrictions that are so inimical to our way of life, that are unprecedented, but people have still followed them because they know that they're important. And that's the approach that we're trying to take for Christmas to make sure that we can keep this, this precious time of year, but we can do so in a way that's safe.
Jason McCartney.
Thank you, Madam Deputy Speaker. I accepted Kirklees being in Tier 3 when we had some of the highest COVID rates in the country. But cases have now plummeted and hospitalisations are down. The case rate in Kirklees is around 167, below the English average. In my Colne Valley constituency, the case rates are actually under 100 per 100,000. And therefore, I really thought we had a strong case to be brought down into Tier 2. Now, look, I appreciate the Secretary of State wants to be cautious, but can he tell me when will the next review be? And really, what more do my constituents need to do to come out of Tier 3?
Madam Deputy Speaker, legally there is a review every 2 weeks, but in practice we review every week. And I won't wait a week longer than necessary to get places out of Tier 3 if we can safely do that. And to people across the Colne Valley, I would say firstly that the reduction in rates has been impressive, but we're not there yet. The pressure on the NHS has reduced, but is still significant. But I'd also say to everybody in the Colne Valley that you have a Member of Parliament who probably talks to me about this more than any other in terms of making his case. It isn't for want of effort from the local MP, but this is the decision based on the epidemiology, and I really hope we can get there soon.
Ferrier Clark.
Thank you, Madam Deputy Speaker. Madam Deputy Speaker, can I take this opportunity to wish you and the House staff a Merry Christmas and a very Happy New Year. Madam Deputy Speaker, I've had numerous emails from unpaid carers in Enfield North concerned about access to the vaccine. Can the Minister set out exactly when unpaid carers will be given COVID-19 vaccine, given that they spend their time caring for extremely vulnerable people and can pass on this, could pass on the virus? Any guidance will be huge comfort to residents, unpaid carers in Enfield North. Thank you.
Thank you. The guidance has been set out by the Joint Committee on Vaccinations and Immunisations. I think it's very important that we follow the clinical advice in this prioritisation to make sure that it's fair.
Richard Holden.
Thank you very much indeed, Madam Deputy Speaker. I'd like to thank the Department of Health, Secretary of State for everything they're doing, but I'm sure he'll appreciate, like me, just how fed up my local hospitality sector across County Durham and the North East are. Will you join me in thanking local people for everything they're doing, because we have seen the case rates really come down, and also thank my local NHS staff who I saw when I visited on a night shift a couple of weeks ago, not only giving care to people with COVID, but also really showing love to them as they look after them. But will you commit to a fortnightly review? Will he ignore the LA7 and allow County Durham and perhaps parts of County Durham to go a separate way if case rates come down in the future? Could he update me and write to me about the vaccine rollout? Will he also push the Chancellor for extra support for my local hospitality sector?
Yes, of course, Madam Deputy Speaker. I'll write to him as soon as I can on the rollout of the vaccine across his part of County Durham. Making sure that everybody can get access is so important, and hence we're taking this community-led approach as well as the big hospital sites. The truth is, in County Durham, we do look at County Durham on its merits, on its own, as well as of course, as part of the other North East local authorities. And people in County Durham have been acting in a way that gets the case rates down. I'm very grateful to them for doing that. We're not quite there yet, and there is still that pressure on the NHS, but we're moving in the right direction.
Richard Bergen.
Madam Deputy Speaker, in the last 100 days, over 23,000 people in our country have lost their lives from COVID. That scale of loss was completely unnecessary. It's a result of a second wave caused by this government failing to put public health first. We know the government ignored the scientists' advice in September before that second wave hit. And we know that scientists are warning that the current plans, including for Christmas, are going to cause a deadly third wave. So will the Secretary of State come clean today and tell us how many lives the government scientists are warning him will be lost over the next few weeks under the current plans?
Well, the advice I have and the answer to him is I hope as few as possible, especially as we get the vaccine rolling out. But I just want to pick up something that he said about this pandemic. This pandemic is caused by the virus, not by any government around the world. It's caused by the virus, and that's why it's so important that we all come together to try to tackle it, rather than trying to take this overly politicised approach.
Sir Desmond Swing.
His waitress tested positive, and so the proprietor of the small cafe closed immediately and went into self-isolation. But Test, Track and Trace have not contacted him, so he is without the wherewithal to claim the allowance. Can the Secretary of State fix it?
Yes, if he has the test reference number, I will get onto it right away. If NHS Test and Trace has not contacted the owner, it may imply that he doesn't have to self-isolate, but of course I'll want to look into the details of the case before making such a recommendation. I'll make sure that his constituents get a full clinically approved recommendation ASAP.
Barry Gardner.
Mr. James Canning became our first octogenarian in Brent to receive the vaccine earlier this week. Whilst congratulating him and the Wembley practice team who delivered it, does the Secretary of State share my concern that care homes in Brent have been advised that the 970 doses that are in the vaccine packs can't be split because of the licensing conditions? And this means that those who are over 80 in our care homes may have to wait until February or for the Oxford vaccine before they get vaccinated. Is this the case? If so, why? Because it's hardly the protective ring around care homes that the Secretary of State promised.
Well, I'm very glad to say that we are making significant progress on tackling this issue. When he says it's a licensing concern, that shouldn't be read to imply that it's some bureaucratic rule. It's about making sure that this is done safely. Because if the vaccine isn't delivered safely to the site, then of course it isn't an effective vaccine, and therefore we are taking it carefully to be able to vaccinate in care homes. There has been some vaccination in care homes across the UK, and so it can be done, and I hope that we can make good progress soon.
Dr. Neil Hodson.
Thank you, Madam Deputy Speaker. I thank my right honourable friend for the reassurance he gave me last week about the vaccine rollout to rural communities. And will he join with me in paying tribute to everyone in Cumbria and the wider UK who is involved in the delivery of the COVID vaccination programme? And would he agree with me that the best way we can build a positive 2021 is for people to actively take up their invitation to have this vital vaccine when it comes and get their life-saving jab as soon as it is offered?
Yes, I couldn't agree with my honourable friend more. He knows about these things. And he's exactly right that the best thing that everybody can do is when the NHS calls, they take up that vaccine and get it done. It will protect them and their community and help protect the whole country and get us all out of these restrictions against which we choke.
Wendy Chamberlain.
Thank you, Madam Deputy Speaker. Yesterday on College Green, I met with members of the COVID-19 Bereaved Families for Justice group and spoke with those who have lost loved ones throughout the pandemic and will be spending a first Christmas without them. They delivered a 200,000-strong petition to Downing Street asking for an immediate public inquiry in order to identify and learn lessons. Now, there has been an ongoing inquiry the Justice Group have given evidence to, and that's been the coronavirus APPGs. So can I ask whether the Secretary of State has read that group's interim report and engaged with its findings?
Well, I look at all these sorts of reports, and the team in the department do, to constantly try to learn given that this is an unprecedented situation, all of the health authorities across the UK, whether here or in Edinburgh or Cardiff or Belfast, we're always constantly talking and trying to make sure that all of the insights that can be gained can be applied. An example is, for instance, the fact that we now have contact tracing in the UK up to reaching over 90% of contacts. That has been due to the hard work and the improvement and learning the insights from each other about how we can make the systems better.
Bob Blackman.
Thank you, Madam Deputy Speaker. And I'm sure I speak on behalf of the whole House in thanking my right honourable friend and his team for all their hard work over the course of this year to combat this dreadful virus, but also for updating the House on a regular basis on what action is being taken. Can I give him the opportunity then to just reiterate the key message as we approach Christmas, that anyone who shows any signs of having the virus must get a test, and if it's positive, must self-isolate and not mix and mingle with people to cut down on the spread of this dreadful virus, and also to think twice before they mix with elderly relatives if they have been in contact with anyone who's had this dreadful virus.
Well, I agree with every word that my honourable friend has just said. Over this Christmas period, I hope that people will, yes, take a moment to have some relaxation, given especially what a tough year it's been, to have the chance to see loved ones, but do so carefully, knowing that 1 in 3 people who have this disease don't know that they have it because they have no symptoms. And so anybody can be inadvertently passing it on to a vulnerable loved one, and so therefore needs to be very, very careful. To reiterate that it is in the best interest of everybody and their loved ones and their community to get a test at the first sign of symptoms, and testing is now very, very widely available right across the country. And of course, if the test is positive or if they're contacted by NHS Test and Trace because they're a contact, then to isolate and do so not just because they have to, but because it's the right thing to do to isolate fully and properly. And finally, I strongly agree with my honourable friend in wanting to thank you, Madam Deputy Speaker, the whole of your team and all of the staff of the House for supporting me in the many times I've had to come to the House this year, and supporting all of us in what has been an incredibly difficult year for the House as well as for the nation, for the work that they have done to support us in keeping our democracy going all the way through this, no matter how bad it got.
I thank the Secretary of State for his kind words, and the whole House, and certainly the whole of the Speaker's team, thank the Secretary of State and his ministers, and indeed the shadow ministers, who have worked so hard to keep us informed all the way through this dreadful pandemic. And it's all right, the Honourable Member for Stratford, I have not forgotten that we have a late entry. The final question. Jim Shannon.
Speaker, can I take this opportunity to wish you, Madam Deputy Speaker, a very Merry Christmas and Happy New Year to you and your family, and thank you for all that you do in this House as well. Secretary of State, can I congratulate you, Secretary of State, and all your team for your energy and dedication in what has been an extremely difficult year, and it has given us encouragement whenever you came to the Secretary of State came to the House to make the comments. But can I ask us, students, families and workers from England, Scotland, Wales and Northern Ireland will be travelling by boat, by train, by car, by plane to meet their families from Tier 3 to 1s to very, very strict conditions. What discussion has the Secretary of State had with devolved administrations, in particular Northern Ireland, to ensure that travel can continue to happen within the regulations that we must all adhere to?
Thank you very much. Well, they were very kind words, and he said that people have been encouraged every time I've gone to the dispatch box. Given some of the things I've had to announce, I'm sure that isn't quite true. But it has been my my duty to come and answer questions as much as possible, and I've probably answered more questions from the Honourable Gentleman than from anybody. I'm very happy to answer this last one for this year. I spoke to Robin Swan, the Health Minister for Northern Ireland, this morning as part of a call with all four of us across the devolved administrations. We're determined to ensure that people can travel across the whole of the UK as much as is safely possible. But again, we urge that caution and the personal responsibility so that people can take advantage of this change in the regulations over Christmas to see loved ones, sometimes loved ones who they haven't been able to see all year. But we urge people to do that with the appropriate concern to the risk of spreading the disease and make sure that therefore everybody has a Merry Christmas and a Happy New Year, and that we will return here, no doubt, in 2021 with the hope of that vaccine coming fast into view so we can get to the point where I don't have to return every week to discuss restrictions, and instead we can all get our freedom back.
I thank the Secretary of State for his patience in going through the whole statement, and to everyone who is here to continue doing their duty on behalf of their constituents. We hope that the Secretary of State has a little bit of rest over Christmas, but we're all pretty sure that he will continue working to try to keep our people safe. Thank you. In order to allow everyone in the chamber the safety to leave without the hordes coming in for the next statement, I will suspend the House now for 3 minutes. Order!